Well, today is World Diabetes Day, which raises global awareness of the condition that affects more than 200,000 people in Ireland. The Irish government has been criticised for not investing enough in tackling type 2 diabetes, as it's believed that many patients could achieve remission if they had access to surgical treatments. To find out more, I'm now joined by consultant surgeon at St Vincent's University Hospital and IrSPEN member, Professor Helen Heneghan. Good morning to you, Professor Helen.
Good morning, Karen.
Really interesting. I had the perception that diabetes was just something you had to learn to live with, treatable with medication, lifestyle changes. Tell us about the surgical option then for people, because the outcome is excellent.
Yes, so again, it is a misconception that diabetes has been today considered a progressive chronic disease, but now with evidence has accumulated over the last number of years, we've realised you can put diabetes into remission, specifically type 2 diabetes. So you can achieve remission of diabetes through significant weight loss. So if a patient who has the disease of both obesity and diabetes can manage to attain a 15% weight loss, which for a lot of people will be about 3 stone. If someone was 20 stone to begin with, then their diabetes can go into remission. But achieving 15% weight loss is really difficult through diet and lifestyle changes. It's almost impossible, except for maybe 1 to 2 people in every 10.
Wow, so only 20% of people can get there by themselves by changing their diet. And about 30% through medication.
Yeah, we have some good medications now that help with both sugar control and with weight. But again, of all people who get them, probably only about 1 in 3 will respond. And they're very expensive. And if somebody does respond and loses weight, they have to stay on that indefinitely. And then
the surgery
is really interesting.
Yeah, so what happens within the surgery?
So the surgery is primarily for obesity. It's previously been considered obesity surgery. And we're now we prefer to call it metabolic surgery because that better reflects what it does. So it's surgery on the gut. So either making the stomach smaller or both doing that and changing the route of the small intestine. So the terms for the operations will be a sleeve gastrectomy and a gastric bypass. Also labeled bariatric surgery. They are known to put diabetes into remission in up to 70 to 75% of patients.
So dumbest guide for me, you're restricting the size of the stomach in much the way that I would think of a gastric band used to do.
Yes.
So it just means physically you will feel full, you just can't put as much food into your body as before. And therefore it results in weight loss.
That's exactly right. But actually surgery works in ways other than just through weight loss. So we know that if you remove, for example, 3/4 of the stomach, which I would do with a sleeve gastrectomy, you change the gut hormone profile. So you change the levels of hormones produced by the gut that communicate with the pancreas, the liver, muscle tissue, and the brain. And actually, so the surgeries work in ways other than just through making the stomach smaller.
But is there anyone that the surgery isn't suitable for? Because, I mean, this seems sort of like the miracle cure.
No, it does. It seems like a no-brainer in many ways. I guess, patients have to go through an extensive workup to demonstrate suitability for surgery, and obviously have tried non-surgical treatments first. So through weight loss, try on their own, and a lot of people can manage to lose weight on their own, but it's keeping that weight off that's the most difficult part of it. And therefore, but in addition to that, surgery has these quite unique benefits for diabetes that are not widely known either by patients or by clinicians.
What work would a patient have to do in the lead up to surgery?
So at the moment it's very onerous. We don't provide enough of this surgery in Ireland. In fact, we provide the fewest numbers of these surgeries in the Western world, so across Europe and in the United States, because we don't have a funded treatment program specifically for the disease of obesity. The government does invest heavily in diabetes management, but I think a lot of that money is spent. It's primarily spent on medications. I think if we offered surgery both earlier and to more patients with type 2 diabetes and obesity, we could save the health service a lot of money.
Do you think patients would be reluctant to have a surgical procedure? Is there a stigma about surgery and obesity in this country?
Yes, I regret to say that there is a huge stigma that precludes people both asking for the treatments that they would respond best to, and it affects clinicians offering the treatments to patients, because obesity has been considered people's fault, that people have been judged, they've been told they eat too much and don't move enough, and that's not the case. It is a disease, just like type 2 diabetes, and it's a disease that we have excellent treatments for, but again, we just don't provide enough of them.
Cost-wise, you mentioned it would save the HSE money. So currently, how much does a person with diabetes cost in terms of medication.
Yeah, it's astounding actually. So if somebody has type 2 diabetes and they've gone on insulin, the cost of medications alone, so aside from outpatient clinics, hospital attendances, admissions that are quite expensive, the medications cost almost $5,000 per year.
And then the surgery.
So surgery costs roughly about 10,000. So it is expensive, but you can put, like I said, patients can come into hospital on lots of medications and insulin for type 2 diabetes, have this operation, and 70% would leave hospital without medications. Their diabetes is already in remission. So
leave hospital like in a matter of a day?
2 days, 2 to 3 days.
And how do, in terms of, maintaining that? I mean, is this forever? Like, I mean, are they good forever, or what do they need to do to keep themselves healthy?
So when the surgery works that well, in about 70%, it can be for forever. So remission can last. Obviously, we watch patients really closely, and if patients regain weight, which is uncommon, then diabetes can come back. So we do watch for that. And it turns out that about 1 in 3 will maintain that remission long term.
Wow.
So you recoup the cost of this surgery within 2.5 years, and every year thereafter then you're saving money that will pay for another treatment for another patient. But we can't afford not to do this, because we're spending all that money on medications indefinitely, which could be invested in surgical treatments and other treatments for obesity that would prevent the problem or put it into remission where it exists.
And in terms of age, gender, is it going to be a one-size-fits-all for patients?
It can be. Obviously, we tailor the treatments to suit the patient, and it's not for everybody, certainly. There are very few contraindications to this surgery. I suppose the first being, that patients either don't want it. And I think stigma affects that decision-making, where patients feel it has been.
The risk of going under general anaesthetic, or is it they'll be telling people, oh, I had surgery to deal with my obesity?
I think because they've been stigmatised and judged, patients think getting surgery is the easy way out. That's a misconception, and they don't want to put themselves forward for that. They believe that because they've been told that for so many years, which is so unfair. So patients don't ask for this enough because they feel it'll look like the easy way out, whereas in fact I really think, as I said, it's not for everybody, and it's definitely not the first intervention. But when the diet and lifestyle changes haven't worked, and the first and second line medications for diabetes haven't worked, then this should be considered and offered.
Professor Helen, pleasure talking to you. It's a really interesting area, and I wish you the very best luck with your work on it.
Thank you.
Thank you. So